Yellow tape encircles the scene of another fatal police encounter, this one just north of Toronto. Police were called to this home after reports that a man inside was trying to set the place on fire. Neighbors say he had a history of strange behavior. Just 2 weeks ago, a 29-year-old woman in mental distress plunged to her death after police were called to her apartment. It's not clear what happened, but Regis Korchinski-Paquette's death renewed calls from the Black community to defund the police, diverting police funding to other community support services, something echoed by this mental health advocate.
Far too often, I feel like police escalate situations to the point that someone in crisis ends up dying.
A CBC News analysis of 17 years of fatal interactions with police in Canada found that 42% of those who died were mentally distressed at the time. People like Michael Ellegon, a Toronto man gunned down as he ran towards police with a knife. And Paul Boyd, shot multiple times as he crawled toward Vancouver police. Arthur Gallant has been apprehended by police multiple times when he has been in mental crisis.
I feel like a criminal. I believe police interacting with someone who's in crisis is essentially criminalizing mental health.
The head of Hamilton's innovative crisis response programs says police are a key part of what they do. It routinely pairs specially trained police with mental health workers.
It would be unsafe, frankly, to send mental health workers on their own to a 911 call.
The Canadian Mental Health Association agrees.
I don't think it's an us and them, and I really would like to think of it in the context of the individual who's in crisis and what do they need.
The answer, she says, more, not less money for police training and more for mental health services, so fewer people end up even needing police intervention in the first place. Katie Nicholson, CBC News, Toronto.